go.
We're live.
Good morning, everybody. I don't know if you noticed, but we got a new webcam.
Oh, yes.
We did.
I saw.
It's different than like the actual like Canon camera.
Or photo. Yeah, the actual camera.
It was like a photo camera that we use for video. So different. I like it. I think we're very,
I
very
kind of
pretty.
thought we looked orange, but maybe not.
Well,
I thought we fixed it.
Okay, so listen. Here's the thing. I'm going to die because I know Ben's watching this right now. So Ben is actually the person who comes in here and kind of manages what does the lighting doing, what's the saturation. He's also colorblind.
You know.
So he came in here and he literally said, okay, I think I fixed it. Usually our videographer, Alex, comes in here and checks, and sometimes he has to change the coloring. He's like, but this time I got Clayton to come in here. It should be good. Then he comes back and he goes, if it looks bad, it's because Kari had me change it. So it's not me.
I thought it looked really orange when I got in here.
It's still a little orange, and I know he's watching it.
He lowered it, and I was like, oh, it looks better. But now that I'm looking at it again,
it might be a little...
Maybe it's still a little too orangey.
We'll figure it out.
Don't worry, we didn't do any
This is actually
tans.
like Olivia circa 2013.
Do you know,
where tanning
never
was
in my
life.
life, I've never done a spray tan. They
Are you serious?
Me. Never.
Spray tanning scares you?
I don't know why. I don't know. I have this fear of being orange.
You've watched Friends.
Well, duh, I watched
where
that.
like the spray tanning incident. You did 2 4s? You're an 8! Yeah, it's so, I mean, like, that doesn't happen because you're not an idiot.
I think it's the, like, smell and, like, the fear of having my hands, like, orange.
Yeah, no, and, like, if you don't, listen, we don't have the time to talk about, like, that's a valid fear, because every time I go spray tanning, and again, I haven't gone spray tanning in literal years, but, like, when I did, I would always have, like, the sides of my hands would be orange, and, like, my feet would, because I just, yeah. But welcome, everybody. If you have any horrific spray tanning stories, please let us know. You can put it here. You can text us. This is the text line right here, and I'm looking at my text message right now. Yeah,
we
sorry,
love
Ben.
everything you do.
We do, and it was the funniest thing. No, Ben, you don't have to come in here and color correct. It'll be okay. Like, we'll be okay.
We'll be a little orange today.
Maybe just against Olivia's circa 2013. But something that, again, I wanted to, before we get started on the cafe, I asked Kari a question as she was talking. I'm like, hold that thought. The world needs to hear what we're talking about.
It is not that great.
So,
at all.
Again, this is the pre-chat where we kind of get on a little early and just kind of talk about things that we want to talk about or answer any questions. But what I was asking the question is, like, I am literally, our company is putting crazy resources right now in ancillary production and just being like, how do we get, Medicare is going to do what Medicare is going to do. Right now, the industry, the world of Medicare is, like, bizarre. What can we be doing to help kind of level the playing ground? And that's ancillary production. The CMS is not involved in that. What can we be doing? Next week I'm making you blue. What can we be doing to make sure that our agents are producing those ancillary products? And I asked you, how much can't you do right? And you said, I really don't. And I said, why?
Don't.
So
I think
why?
I have 4 cancer policies.
Why don't you write a ton of cancer insurance?
I need to do more because I believe in it. I do believe in it.
Do you have a cancer policy on yourself?
Yes.
Okay. Well,
yes. I know.
Okay,
so
no, go ahead. I'm not judging you out loud. Please continue.
I get so stuck in my ways of so much of, like, 75 to 80% of my business comes from financial advisors, as we know. And so many of those advisors themselves do long-term care.
Sure.
They do life insurance. And the client themselves have assets, enough money the majority of the time that, I don't want to just be pitching more sale. I don't know. I'm afraid I'm going to come off salesy to the advisor. I don't even know how to explain it.
So I feel like
it's a combination of them. I know that they have the assets to pay for that type of situation.
But don't you think they want their assets to go towards what they work so hard for, not go towards their cancer?
Yes, I do.
So, like, you believe all this.
I do.
Yeah.
And that's what it's more of. I need to have the conversation with the advisors to let them know hey, I'm going to start talking about cancer insurance.
I would say all you have to
That's where it
do
needs to start.
is show the statistics and show the fact, and show them the statistics that say, close to 70% is non-medical expenses. Like, all you have to do for a financial planner is show them the numbers about why. And then the only thing you have to say to the client during the appointment is like, and I also recommend that you don't change your cancer insurance. I also recommend that you keep your cancer.
Mm-hmm.
And then they say, what? And then you go into that. Like, I understand, like, you have to sell the...
I just need to have a conversation with the advisor first.
Like, you believe in it.
I do.
You understand. I think all the advisor needs to see is
it's
just,
mental for me.
It is. And I think if you're feeling, because I've worked with a lot of agents in the past, it's like, I don't want to feel like I'm pushing product. I don't feel like I want to sell them. But then, so you need to switch your mind shift to what happens when you don't.
True.
Like, really, play that out. What happens if you don't talk to your clients about cancer insurance?
Then if they get cancer,
then they're spending the money that they've worked for, or having to pull money out of the stuff that the financial planner has them in to pay for it, to facilitate treatment, to do all that stuff. So that's what happens if you don't.
I set so many of these relationships, like just saying, I do Medicare. And because of my CFP, I always have this secret worry in the back of my head that they think I'm going to, like, I don't know, do more than just Medicare. And I think, and I haven't really realized all of this until you just asked me. So this is just some therapy right here.
Yeah, that's fair. I think
I'm in my head. Moral of the story.
You're in your head.
I just need to sell more because I do believe in it. Me and my family have cancer policies.
I'm going to follow up with you on this. Like, because literally this is something that, like, I'm devoting my life to right now. Okay. It's because, again, everybody's affected by cancer. My dad passed away of cancer. Like, everybody knows what it looks like. It doesn't favor the weak, doesn't favor the poor. I'm going to keep on you about this. Because mainly because I want to try my methods of madness on you, and you report back and say, like, this worked, this didn't work.
So are we going to have, like, a cancer podcast?
We should. I actually have that written down.
Okay,
to have, like, a cancer podcast.
Because I need to be better at it. I need those statistics.
Well, get with my good friend Clayton, who is running up our task force for cancer, and we will get you anything that you need. Like, we'll even build the presentation for you of, like, here, show this to your financial planners. Okay. And then you have to do it.
Because, like, I will. That's the encouragement I need, truly.
Okay. I'm in.
I'll be a guinea pig.
I wasn't ready to be like this. I told Kari, I was talking to some other people. I got a little worked up on some other things.
She came in here saying
I came in a little flustered. I came in a little, like, hot. And now I'm just like, wait. Now I'm taking it out on Kari.
Bring it on.
That's not why we're here today.
My filter.
I live here. This is where I go. Welcome to the Medicare Cafe, guys. It is past the top of the hour. Today we're going to be talking about
see the clock.
Growing your
agency.
It's on my wrist. It's 10:05.
There we go.
So we're going to be talking about growing your agency, and this is kind of like a 201. One thing I want to clear up is the word agency. Because, right, would you consider yourself, Kari, would you consider yourself an agency?
No, when you first asked me about this topic, I was like, yeah. What can I contribute here?
Yeah.
Yes, but no, then I was like, oh, wait.
Do you have administrative staff?
I have an assistant, yes.
You're an agency.
I know.
So I think that's the thing that's like, if you have your insurance license, if you have a national producer number, you are an agency. I don't care if you're a shop of 1 or a shop of 200. If you have, and we need to be looking at our businesses that way. I'm sorry, I'm coming off very preachy. I am hot.
No, you're not.
If you have your agency, if you have a license, you need to look at yourself as a business owner. Sometimes you're a small business owner. Sometimes you're this corporate giant. But you need to look at yourself and measure your success based on those metrics of what does it take to be a business owner, an agency
I think
owner.
I see myself as a business owner.
You do,
sure.
yeah.
I just don't think of it as the agency to me.
Yeah, and I think, like, that's me. I think you're in the camp of a lot of people.
Yeah.
What most people would say that. I am just saying, like, when I say agency, this is what I mean.
So you mean me?
I mean you. You're an
Okay.
agency. So the first thing I want to talk about, guys, is the 3 methods of growth. Number 1 is adding a product line, not to harp on cancer too much, but, you know. The second is adding downline, and the third is adding administrative help. And what's funny about this, especially when it comes to downline or admin, a lot of times it's an either or situation. And people
You're going to have to educate me on downline.
Yeah, people think that like, I want to grow, so I guess I need to add downline. When it's like, ooh, do you really have the right expectations of what growth looks like with the downline? So we'll talk about that a little bit more.
I'm really curious how my assistant fits into this.
Yeah, we'll jab. So let's get into the first thing. We're talking about addict. I'm an addict for cancer insurance, adding a product line. And by here, I talk about I don't want to add any extra work to you. I don't want to add any extra because when you add a product line, you're actually offering lower acquisition costs and higher profit per presentation, right?
Okay.
And so if you're spending a ton of time with an additional product line, that means you're spending less time on your main income, right? So when you add a product line, it's a great thing that keeps you productive but doesn't add busy work. It's something that literally takes next to no time to incorporate into your agency, especially if you're working with a great partner that can help you with materials and tools and things like that.
I feel like my RSSA.
What does that mean?
The service, no, the Social Security.
Oh, I was like, who's she? Sorry.
Like that would be, I don't know. I mean, because that was definitely more work.
Yeah.
But that would be.
But I wouldn't say that's a product line because you can't add that to a presentation.
So product line, we're talking just cancer, heart attack, stroke,
long-term care, hospital indemnity, all the short-term care, all the goods. And the reason for that is because they actually can grow your agency two different ways, right? One of it is the lower acquisition. One of it is the profit per presentation. So by profit per presentation, what I mean is selling an ancillary product. Again, my go-to would be cancer insurance because I'm obviously very passionate about that. But it's talking about profit per presentation means that, okay, this client comes to you, right? Whether they show that actually was like 5 years ago, the average client acquisition cost was around $185. I bet that's way higher now.
Dang.
So
higher than that?
I have no doubt. That was 5 years ago before inflation, before all the craziness that we're into. Wow. But that was just an industry average.
Okay.
But what they're saying is if you look at a Medicare supplement or a Medicare Advantage commission on that, you're saying, okay, we'll take whatever commission you think you made and subtract your acquisition cost, which is roughly $185.
Okay.
They're saying, okay, so that's, your core product pays for that client, honestly, that first year.
Right.
Okay, so let's look at how do you make higher profit per presentation. The same time that you sell that Medicare Advantage or Medicare Supplement plan, of course, with Medicare Advantage, you got to worry about what's on the scope of appointment, but talk about a cancer insurance policy. Yeah. Talk about a hospital indemnity plan. And you're building you're not selling product, you're building a comprehensive package that, complements what coverage you're offering them.
Right.
So you're building this whole package. And the more policies that you write at that appointment, the higher profit per presentation.
Makes sense.
Now, I'm not talking about, adding alien insurance, adding this insurance, adding that insurance. Do not ever sell a policy that you don't believe in or that you don't believe the client needs.
Right.
But I also don't take away the opportunity for that client to say no. You know what I mean?
Which is what I'm doing.
Which is what you're doing.
Which is what I'm doing.
Because the biggest thing we can talk about when it comes to adding ancillary product and things like that is if your client knows about it and says no and something happens, that's on them. It's devastating and you're so sad about that, but you can sleep at night. We've had it. I was actually at a training. I conducted a training in Denver with our partners at Senior Insurance Marketing, and Mike Roth was there. He's the principal of that group. He literally, the day before at training, he was on this panel and just broke down crying.
Oh, no.
And he said, I got a call yesterday from my client who I had an appointment with her. We got really, really rushed. And so I just kind of had to shut the appointment down early. I got a call from her yesterday saying she had cancer and asked what I could do.
Oh, gosh.
And he's like, I offer cancer for everybody, but I didn't offer it to her.
And
she had cancer, and she just called me.
Like
and he literally broke down crying on that stage. And so that's why, again, we don't have time to get into the whole talking about, ancillary production. But profit per presentation, how do you grow your agency? You grow your revenue.
Yeah.
How do you grow your revenue? By increasing profit.
And the more policies you sell a client, the longer they'll stay with you.
We all quote the same, like, 2012 LIMRA study. That's, like, if they have 3 policies with you, they're over 90% likely to stay loyal. One policy with you is less than 30% likely to stay loyal.
30%, wow.
So, I mean, like, that's the study that's been going on. It's a LIMRA. I've been quoting it since the beginning of time. But it's true. The more policies, the more likely there's, especially in a world where convenience is king.
For sure.
And... Go ahead.
Oh, I was going to say Michelle had a good question. Does cancer fall under hospital indemnity products under the SOA?
So it depends on who you talk to. My personal preference is I'm rather safe than sorry. I don't talk cancer with a Medicare Advantage appointment because it's not listed specifically on the scope. There is cancer insurance riders on hospital indemnity plans, but I don't like those either because when money gets tight, if they decide to cancel their cancer or they decide to cancel their hospital indemnity, then like you lose 2 policies with one stroke of a pen. So I do like with a Medicare Advantage plan, I would probably not sell cancer. Other people will tell you differently. I err on the side of like I don't, especially in the times we're in right now, I don't want to be the one they make an example of. So I say for Medicare Advantage, cancer insurance is a great follow-up appointment, but hospital indemnity for sure at a Medicare Advantage appointment.
And so there wouldn't be anything you would need to get signed then for a cancer.
What do you mean?
Right? Well, like if you're talking about like the hospital indemnity, you check that off on a scope. There wouldn't be like there's no like scope for cancer.
Cancer is not on a scope of appointment. Some organizations will argue that some scopes, not most of them, but there's like 1 or 2 scopes out there that'll say other health plans because the scope of appointment is designed to not let you talk about financial products.
Right.
And so like cancer is obviously not a financial product. Well, you could argue that it is because most of them are lump sum. But anyways, some plans scope appointments will say other health products. And I've only seen like 1 or 2 scopes.
Who is it? Is it Aetna or Blue Cross? Yeah, they have like 5 things listed on their scopes, which I feel like usually there's just like 3.
Most of them do have most of them will have MedSup, Medicare Advantage, Part D, dental, vision, and hearing, and hospital indemnity. Dental, vision, hearing, and hospital indemnity are the ones that typically have that. Yeah. But I don't know. Interesting. Something worth looking into.
Yeah.
So in addition to with adding product line, having profit per presentation, it's also like retention. Even if you have a Medicare Advantage appointment, follow up with that person and make sure you discuss the cancer.
Great retention.
It's a great reason to reach out to people and just saying. And a lot of times, people feel uncomfortable bringing up cancer. 2 ways I've heard people talk about cancer is what are your plans? So tell me. We know the statistics. It's now 1 in 3 men, 1 in 3 women. Thankfully, that number went down a little bit. What are your plans for your cancer? Are you aware of how Medicare and cancer work together? The other way, which I like way better, is hey, I've taken care of all this other stuff for you. We didn't get a chance to talk about it. Don't drop your cancer plan.
Oh.
That's like, it's just assuming that they have it. And so, because if you assume that they have it, then it's this thing like, oh God, I haven't had that this whole time. Yeah.
You know what phrase I like?
Tell me.
Is how has cancer affected your life?
I love that. Because it has. Everybody.
It has. And because it's typically, oh yeah, my mom, or and then it's also a digging question. You hear who had the cancer, or if it's them.
I think they say it's 3 out of 4 family members experience cancer.
I feel really lucky with those statistics.
Yeah,
because my family has not had.
Really? Yeah. They say 3 out of 4 families. That's a statistic that Clayton just found. 3 out of 4 families have experience with cancer. So yeah, so keeping that in mind as well. So
we need those statistics. I want to follow up with you on a cancer podcast.
Okay, I love it. Yes. So again, that's a lot of the discussion again about growing your agency is the fastest way. By adding a product line to your agency, that is the fastest way to grow your agency. It's long-term growth.
Interesting to me.
It's long-term growth because you're not having, let me say, it's the fastest way and it's the least costly way. It doesn't cost you anything to add a product line to your agency.
So don't you feel like, what are the statistics of people? One of the reasons I feel like I don't sell as much ancillary is I feel like they're also quick to cancel them.
Listen, that's a very great point because when money gets tight, which it is for a lot of people right now.
So what's the cancellation rate? Do you know that?
Depends on how it's sold. The biggest example of that I can give you is cancer insurance. And I don't know the cancellation rates. I don't know the statistics. But when we see cancer policies get canceled, oftentimes it's because they were sold on fear tactics.
Okay.
So when you sell something based on a fear tactic, and that's more so the delivery, like the statistics, all that's scary enough. When you deliver this information and trying to get somebody to be not uncomfortable,
act on fear.
but act on fear.
Yep.
Fear is an incredibly powerful emotion, but it's very temporary. When you remove the source of fear, you remove the fear itself. And so when you as the agent presenting the information are the source of fear, saying you're the one presenting the information this way, when you leave, people are not buying that. They're buying that emotionally.
Yeah.
And they are not using the correct logic to justify that. So when you remove that fear, it seemed really great at the time. The minute money gets tight, you remove the fear, you remove the logic there. So they'll cancel that policy. But you're absolutely right. There are much higher rates of cancellation.
What the cancellation rate
That's
is.
a really great question.
I feel like final expense has to be the highest.
I'm sure. We see that. That's why final expense, you get chargebacks. It's because that's the highest rate of cancellation for that. See less of it with the other ancillary products. The least amount you're going to see of that, and I'll tell you.
Home healthcare?
Home healthcare.
Yep.
Home healthcare and dental, because they actually use the benefits.
Right.
With home healthcare, it's the RX benefit that they use. Dental, it's the cleanings and the x-rays and things like that. Cancer, less than, because there's not a usable benefit. Well, I say that.
There's not a usable benefit.
There's not a usable benefit until they get cancer. Compared to like a dental plan, or compared to the home health care plan where they use the policy when they're not receiving home health. So those are going to have the highest retention and they're the lowest cost. But I imagine like with a cancer insurance plan, you can buy a really nice cancer insurance policy for $30 a month. You know what I mean?
Yeah.
Which for some people that's a substantial amount.
Right.
But you can adjust the cost. That's a great question. Don't sell based on fear. That's the biggest advice I can give for that.
It'll get canceled. For sure.
So that's one way. There's two more ways that I talk about agency growth. This one is the one I get the most questions about. And it is basically the question of, do you want admin or downline?
You've got to educate me on downline.
So
I know what an admin would be.
So let's talk about like a downline is going to be somebody who is writing business under your name. Think about like this. Like this is a bad example.
Okay.
But think about like MLMs, like a Mary Kay person. You sell Mary Kay products, right? Or you sell Tupperware, whatever the case may be. You sell a product.
Okay.
If you recruit somebody to sell product under you, every time they sell a product, you get money from them writing. It's not as much money as they're getting, but you get, if they sell like a $10 piece of Tupperware, you get $1 off that. So it's in your interest to have lots of people selling under you because you're not going to make a lot of money off one person selling an extra piece of Tupperware. It's $1.
Right.
But if you can get enough people to do that under you, then you start getting $1 from a bunch more people who are selling this product.
So I think I thought I hired an admin, but it sounds like I hired a downline.
Well, let's talk about that. So here, just some general questions you need to talk to yourself about, because I do talk to myself. So general things when it's like, should I grow via downline? Because when people hear growth, the first thing you think of, okay, I need to add downline. Because if I can just literally do nothing and they're selling policies, and no, I'm not getting a ton of money, but I'm getting money by sitting here and doing what I do and they're writing policies, that sounds great. Like downline seems like a duh response. Some questions you need to ask yourself. Do you want to continue to write business yourself? Is the majority of your time productive, or is the majority of your time doing busy work? And by that, I mean, is the majority of your time sitting across the client, or is the majority of your time doing paperwork?
Right.
And then are you willing to take a short-term loss for a long-term gain, or vice versa? Right? So that's the questions you need to ask yourself if it comes to, do you want an admin, do you want a downline, or do you want both? And this is the expectations I want to set. Downline.
Okay.
If you want to bring on somebody who is a downline, meaning that you're here, you're writing business, for every app that they write, you get a small, we call them overrides. You get a small amount of money for every piece of business that you write.
Okay.
A lot of people try to go that way because it seems like I don't have to do
Easy
anything
money.
and I get something extra. Couldn't be further from the case.
Yeah, because you have to train them to be you.
On average, you're exactly right. On average, if somebody, for every downline you add, you will lose about $10,000 of income in your first year.
Interesting.
And that's just what we've noticed. And the reason for that is because, and it's a short-term loss, long-term gain, right? If you can keep that downline with you, but it's because you have to ask yourself, when a person comes down under me, they're representing you, but they're giving up a portion of their commissions in exchange for being an agent with you.
Yep.
What are you offering them they're paying you to be their upline? What are you offering them? Are you offering them training? Are you offering them systems and processes? Are you offering them leads? Are you offering them a brand that they can plug into and build credibility by your brand alone? All of that comes with, you have to give something up. Oftentimes you're giving up resources. Is it your time? Is it some of your clients to help train them? What are you giving them in exchange? So when you bring on a downline, you are actually taking a backseat. What we see oftentimes, you take a backseat to sales. You are no longer selling as much because you don't have the time to, because you're managing your downlines and you're training and you're keeping them motivated. So that's where we see, if you're going to bring on downlines, do not set the expectation of, okay, I'm just going to keep doing my thing and now I have people selling under me to make me money. No, your personal production, at least that first year, per every app, per every downline, your personal production does go down.
This might be a technical question, but if someone is your downline, like, is it their name that's like on the app as their agent, or is it my name?
Yeah, that's a great question.
Or is it both?
It is the downline's name.
Okay.
It is the downline agent's name.
And so, but the commission goes to...
So there's two types of downline agents. And it is more of a technical question, but it's worth knowing. There are license-only agents, LOA.
Okay. And
there are sub-agents. Those are two different types of agents. What a sub-agent means is that if you are writing business under, let's just say in my case, Joanne Ray is my principal. Joanne Ray is the president of senior marketing specialist. If we're agents, she's my principal. If I'm a sub-agent, the carriers will pay me. She doesn't get my money. She's not paying me. The carriers will pay me, and I own my book of business. She just gets a small piece of the pie on top of that in exchange for whatever services she's offering to me as her agent.
But who's paying her that? The carrier?
The carrier.
Okay.
All of the finances is handled by the carrier. Yes.
Okay.
An LOA, or license only, aka solicitor agent, means that I don't own the book of business. I'm only representing Joanne Ray.
Okay.
But I am authorized to write it. I don't own the business, and I don't get paid for that business. I'm a representative of Joanne Ray. And so the carriers pay her,
and then she
pays me.
Okay.
But she owns the business. She is the, and I'm the agent of record and things like that. But like if I leave Joanne, if I say I'm going to go be an agent elsewhere, then she keeps my business.
When is one more advantageous than the other?
It just depends on what the agency is looking for. You should go, if you are somebody wanting to go LOA, you have to understand what are the pros and cons to that. Having an LOA downline means that you're responsible for bookkeeping, you're responsible for paying, you're responsible for issuing 1099s or whatever. It can be an accounting, booking nightmare. But in exchange for that, you own that. So if that agent leaves, you own that business and you will continue to receive renewals on that business. Compared to sub-agents that I let you do your thing. I don't have to be involved. It's less paperwork, less work on me because I don't have to actually manage your pay. But if you leave, that book of business goes with you.
I would think, is the LOA more common?
I literally see across the board. It all depends on how involved the agent wants to be.
Right.
If you're an agency that's providing technology, training, structure, branding, marketing. If you're an agency that's doing all that, you better have LOA agents because you're investing a lot of money, a lot of resources. If you're somebody that's like, they're going to be under me, but they're going to do their own thing, sub-agent's probably the way you want to go.
Okay.
Yeah. So
this is really good stuff for me to hear.
Yeah. So on the other side of that, so this is downline again. Downline, the question you need to ask yourself, if you're wanting to be like an MVP, if you're wanting to rate the business, if you're wanting to be the big person in charge and everybody asks for you and you want to focus on yourself, downline's not the way you want to go. But if you want to take a backseat of that, if you want to invest in other people's success, if you want to make sure that you are building a brand worth selling to and something that is really, the word I would use is growable, something that is replicable, then downline might be a really great option for you. So moving on to the third way of growing business is going to be adding an administrative staff or administrative team.
Yes.
This is it's not as quick as adding a product line, but this is a much quicker way to success, and you can get there much more. And it's a little bit more short term. But the reason why it's more short term is because oftentimes with administrative positions, you have to replace them more frequently than sub agents or than the downlines do. So you do have to make sure the training is also easier for an administrative team because you don't have to teach them the selling process.
Right.
You teach them what do you need, Kari, in your day to help you go from busy to productive.
So this is exactly, 2 years ago when I found out I was due with my youngest, like 3 weeks before EP started, I was like, I'm going to need some help.
Yeah.
So I hired an admin that I knew was going to be short term. Like I knew she was going to be leaving within like a year. She was literally just my admin to help me funnel calls, call clients back timely, help me schedule, submit apps, like do all the back end work. So she was a true admin. I didn't teach her really anything sales related.
Yeah.
But now I'm just realizing my new assistant that I hired, I was thinking she was going to be more of an admin, but now like everything you just said, she's really a downline.
So let's talk about that, because I'll tell you one of the biggest mistakes when I'm working with agents and they're going over agency growth. The biggest thing that I hear agents is that they want their cake and they want to eat it too. And that is having administrative staff that sells, right? That seems kind of like the perfect storm. I've seen it work, not often though.
Okay.
And I'll tell you why. It's because oftentimes people who are interested in the administrative side, interested in that sidekick that let me do what I can to help you grow and like let me work on behalf of the agency, oftentimes are not incentivized or interested or have different personality traits than it takes for someone who is interested in selling, interested in building that production. So if you, and I have seen it work. I mean, like in the office.
So can I explain my
Please, let's hear it.
So she's over in Kansas City, and I really hired her to help me be my feet on the ground over there. Networking, meeting new financial advisors, strategic partners over there to help me do what I've done in Columbia over there. She also is doing some, I guess, admin stuff for me on the back end. But ideally, she's going to help me build relationships, connect me with people. I'm going to still be the face. But because I'm not over there, like if somebody isn't willing to meet on Zoom or I can't be at that meeting, I'm going to have somebody who can be there.
Yeah.
And originally, like I asked her when we were trying to decide what she wanted to be, I was like, do you want to be an independent person in the field? Because you can certainly do that.
Right.
But she said, no, I would rather be under you, kind of more behind the scenes.
Yeah.
Because I agree that they're two different personalities. And
it can be really scary. Somebody who's looking for an administrative job, oftentimes are looking for that security. So when you say your income is based on how many sales you bring in, that's not interesting to them because they're into it for a lot of that security.
And so she eventually will write business. She'll eventually meet with clients, I'm sure, on some level. But like that won't be her main goal. So that's like a hybrid.
So we do see, so what you're talking about is actually the same model that durable medical equipment sales reps do. To where you go out there, it's like a pharmaceutical sales rep. Okay. Right? You go out there, you build the relationships, you're representing my brand. You're representing I'm not actually the one who's going to work the equipment. I'm not the one that's going to support you in that equipment, but I'm coming out to your offices to build a relationship with you on behalf of this medicine, on behalf of this durable medical equipment. So that's the brand that you're talking about. And they do really well with a base pay with incentive.
That's exactly what I'm doing with her.
That's exactly how that should be paid out.
But if she was like, she technically would be a downline though. Like if she writes business, it would be an LOA, right?
So if she's writing business, then technically, you would have kind of one of those hybrids that we don't see work all that often, depending on the expectations, and we can talk about that too. But oftentimes you'll have
might not need to have a meeting. I'm gonna get on your calendar.
Yeah, it's talking about like having an admin who is incentivized to write those. We see that a lot of times with like agencies who did really, really well in core products, Medicare Advantage, even like annuity and things like that, they'll hire admin to do cross-sell that business for them. And it doesn't work out nearly as often as you think, because somebody who is interested in like, okay, I'm going to be incentivized by writing this business will eventually be like, why am I doing this for someone else?
Right.
I have the skills. I know what I'm doing. I'm going to go out my own and do this. So
Makes sense.
things to think about. Again, it does work. I mean, there is no
Mm-hmm.
like blanket statements. I've seen it work next door. You know, Clint Geyer, president of SPS, has administrative staff that writes business and does it very, very well.
Mm-hmm.
Just overwhelmingly is not something that I see successful.
Right.
a lot
Well,
of the
and
time.
I told her, I was like, you've got to tell me at some point, like, if you ever like want
Mm-hmm.
to be your own independent
Mhm.
agent. And she's like, I'll tell you, but like, I don't think that'll be me.
Yeah. Yeah. And that's
So
and
I think, being clear about those expectations.
just have the
but-
right expectation. I am a true
Yeah.
believer that success is measured by how well your expectations are met.
Yep.
And so, like, if you are hiring an admin and you're expecting them to blow up the world and write a ton of business and cross-sell your book of business, maybe set your different expectations, because that's just not what we see happen.
Yeah.
Will they? I mean, like, again, what the job on paper, what your admin should be doing is anything that keeps you away from more appointments,
Yep.
your admin can do it.
Yep, for
Checking
sure.
checking the status of applications.
Thank you notes.
Setting appointments, thank you notes, appointment reminders,
Yep.
responding to some of your emails, things like that. Your admin can do that. So my biggest point to there is, like, especially if you're adding admin, what that means is that you want to be the MVP. You want to be the person, like, so you got to think about it. What is it in your day that makes you money? Writing applications.
Mm-hmm.
Why would you have someone who isn't going to be as passionate about that? Because that's not
Right.
their living.
Exactly.
Why would you have someone else
do that?
do what you're so good at? Do what you're so passionate at? Why would you bring someone in who's not going to do it as well as you are?
Yep.
Be responsible for that in your agency. Give them the busy work. Give them the stuff that makes your skin crawl. Have them help you with contracts. Have them return your phone calls. Give them that stuff. Do not offset what makes you money onto someone who's not going to be as passionate about it as you are.
So interesting.
Yeah. So that's just my 2
Michelle
cents.
had another question. Do we need to bond administrative staff?
I don't know. You mean, like, is that like
What
a
does that
light,
mean?
like a securities question? If you're
Like
talking
E&O type?
E&O,
Like, are they covered?
yeah. What do you mean by bond? Because I heard bond and I was like, do you need to like them? Do you need to bond with them? Like, do you need to be friends? I don't think that's what you meant. I will tell you this. Oftentimes, administrative staff, they don't need to be licensed agents. As far as the Medicare side, they don't need to be licensed. They do need to be fraud, waste, and abuse certified. They have to do that on a quarterly basis. If they don't have an insurance license, if they don't take the AHIP, they do have to be fraud, waste, and abuse certified on an annual basis, but that's super
If they
easy
are
to do.
licensed, would they need to have their own E&O?
Oftentimes the E&O, you
wouldn't
can
mind.
buy agency E&O.
Oh,
It's going to cost you more than your individual, but you will have to typically buy an agency style E&O that covers the agency and the individuals under it.
Got it.
Yeah.
She said insurance.
I don't know what that is.
Yeah,
Insurance bond.
I'm not sure either.
Like I said, they don't need to be licensed. They don't need to be certified. The only thing they have to do is the fraud, waste, and abuse training. And yeah, because they just, again, because CMS isn't keeping an eye on them to make sure that they're being
Because it's
compliant.
It's your book of business.
Yes.
It's yours. It's your name.
If they are going to see if they're going to see HIPAA information, which is name, date of birth, Medicare number, bam. If they're going to see that, then they have to be fraud, waste, and abuse certified.
Yeah, makes sense.
Yeah. So that is an intense subject, but that is what we're talking about again. And I even put it on here. Oftentimes, admin and sales
Yeah,
require
for
very
sure.
different personalities. But again, just making sure, keeping an idea, what is the benefit of being your employee? Prepare to be a manager. Being a manager, I think, is
Being awesome.
yeah, right. It's making sure like that you are. I did this training a year ago. We did a webinar on, it was Agency Growth 201. It was a lot of the same content, but that was also during the time of what was known as the Great Resignation, which followed COVID.
Yeah.
When they found out that a lot of people who thought that they were motivated by money, COVID put things into perspective. So people were
Totally
willing
true.
to take less paying jobs for more things like
Freedom and
freedom.
working from home. Absolutely.
having, enjoying the people they work with, enjoying that. So just knowing that, like, things are
Yeah.
different and just making sure that you're ready to
For sure.
handle that. And again, like, we're seeing the effects of that. That's something that there's literally books being written about their Great Resignation as a result
So
of COVID-19.
interesting.
So, yeah. So
Crazy.
how do you feel knowing that you're like, I don't even like, do you feel like you have a good path about like what you're doing with your admin now? All this being said?
I do. I really
Good.
do. Because and I think just it's going to be about being transparent with her. Because like
transparency is huge.
Ideally, again, I've never thought of it like that. Like I am the MVP. She's helping me grow my brand over there. You know, hopefully she's going to get all of us together with the relationship she's building. Me and her and the advisor will meet. We'll build the relationships. I'll do the whole spiel. I will say, I can get over here as much as I can. I can meet on Zoom. If I cannot be here, she's me.
And I'll tell you what, if you do that with admin and downline, the biggest mistakes that agents make who work with admin or downline is they say, I'm your person. You can talk to me. I'm available whenever. And so whenever your admin reaches out to them or tries to handle something on your behalf, they say, no, I'll wait for Kari. You know what I mean? And it sounds like you're avoiding that. But I'll tell you, a lot of us, myself included, can let our egos and our pride get in the way to think like I sell me. I don't sell my services, my admin, my downlines included in that service. I sell me. So it's just a big transition between like, I can help you versus like, hey, we can help you.
Yeah. Well, I'm hoping to set it up that way, especially
Sounds like you are.
Since she's initially the first one setting that relationship.
Yeah.
And then bringing me on as the expert, the face, but then, I don't know, could fail completely.
I don't think it will.
Could go terribly.
No, because everything could go awful.
Everything could go terrible. We're about a month in, so we'll see.
Well,
she's only part-time right now.
What are you having her do? What admin stuff has she taken off your plate?
Oh gosh. Well, right now she's only working for me on Wednesdays right now. So she's only 8 to 10 hours a week, and she's been going through new agent school.
How are you?
I mean, she's literally only worked for me 4 days so far. So
how are you like managing and communicating? Like how are you?
How do we communicate? And just how do we function?
Yeah.
OneNote shared to-do list. Throughout the week, I put things in priority that I need her to do. I put it on a to-do list, and she checks it off when she's done. She writes her comments.
Oh, nice.
And so it's just constantly active. I mean, sometimes we don't even speak on the phone.
Yeah, like she knows she logs in on Wednesday. She knows this is what Kari needs me to get done.
I see exactly
this is what I have time for.
Or like she just texts me like, hey, I'm going to work between this time and this time. So I know like if I need her during that time, she's there and I can call her and say, hey, will you call this person back?
I love that. Very cool. Very cool.
So yeah.
Okay.
Thank goodness for OneNote or I wouldn't function.
Yeah, just having some sort of share. I mean, like Google Docs would work the same, but having something that like it's a live document that I can see what she's doing on it. She can see what I'm doing.
Yeah.
Very cool.
Yeah.
Well, good deal, guys. That is the Medicare Cafe for this week. We talked about agency, meaning if you have your insurance license, you are an agency. Agency growth by adding product, adding a downline, or adding admin.
I learned lots today.
Did you?
Yes.
Good.
Gave me lots to think about.
Honestly, that's my goal. If I can make Kari learn one extra thing, then like I did my job.
Maybe we'll talk about cancer next week. Maybe.
Listen, I'm obsessed right now. I've been on the phone all morning thinking about with different people being like, it's cancer insurance.
I'll do some research too. I'll talk to my guys next
Talk to your guys and figure out who I need to talk to and be like, hey, who is a cancer insurance superstar? So more to come.
We've got some.
Awesome. Hope you guys have a wonderful. It was quiet today on the text line. Quiet. Oh, wait, I say that. Got some text.
Just kidding.
Do virtual assistants work? Asked by Kari. Well, technically
she is completely virtual. We've been in person. She's worked for me just 4 Wednesdays so far. The first one we were in person, but the other 3 have been completely virtual.
I would say.
And it's wonderful. She's so happy because, she has that work-life balance that she wants. And it's easy for both of us.
I'm a huge fan, again, like of having the ability for people, like you don't have to be in the same building to work with each other. But I will say there's also like the word virtual assistant also gets thrown around by companies offering like offshore virtual assistants.
Oh gosh.
Like you pay this company money and you get a person assigned to you.
Yeah.
Depends. I've seen some companies do really well, but oftentimes those types of virtual assistants are actually call campaign people.
It's just got to be someone you trust.
Yeah.
To be virtual. I mean, I think that's all it comes down to.
Because like if
and
they
know
don't,
that they're
Go ahead.
staying on task. I mean, that they're getting their shit done.
I mean, like, you're trusting somebody with your brand.
Yeah.
Like, you're trusting somebody with your reputation.
For
so
sure.
just be aware of that.
Works for me.
Yeah.
But
just to follow up on the TPMO and referral partners. Oh,
what?
that was last week. Someone asked, will a referral partner be a TPMO? Let me
Oh.
screenshot this because I'm going to be level with you. I didn't follow up. I can be strong and say I didn't do that. I'm screenshotting that and sending that to my compliance officer right now. I will get back to you. I will text you back on that.
Do you find the OneNote helps with managing that virtual staff member? For sure.
Mm-hmm.
I mean, I really don't know how I would have a virtual remote assistant without it.
Mm-hmm.
Because I would just have to send her like a million emails. Do this,
which gets
do
lost.
That. It gets lost. Like, I know, and also like when I know she's working, I check in every like couple hours. I'm like, all right, making sure like, yeah, she's completing tasks that I've asked. And also like
has a little bit more accountability.
Yeah, because it's a real live update.
And I don't know the free features. OneNote, I use it. It comes with Microsoft Suite if you use Microsoft. But Google Docs work the exact same way.
Yeah.
Google Docs, you can do that.
I just know OneNote.
A question was, what is 2 questions? To be a downline, wouldn't she need to be licensed? Excuse me. Yes, if you're a downline agent, you do have to be licensed. If you are going to be, let me just put it like this. If you are going to be talking about product at all, if you're going to be doing any type of like product walkthrough, sales pitch, brochure walkthrough, you do have to be licensed. And the reason for that, you have to be not only licensed, but you have to be appointed with that carrier because that carrier has to give you permission to represent their brand. So if you're going to talk about any of the carriers or any of the products, then yes, you do have to be licensed and appointed with that carrier. And then what is New Agent School? New Agent School, we actually have a program called Medicare Quick Start. It is going to be the week of April 17th, April 16th that week. It's a 5-day long program, about an hour and a half a day, where we go over and teach you if you're either new to the industry, new to having a license, or new to Medicare, then we teach you everything you need to know about selling insurance in this industry. We do how do you market yourself, the 8-step selling process, Medicare 101, product 101. We go over all of that.
And that's my company just calls it New Agent School. It's a little bit just like an onboarding training.
Yep.
Michelle says, is OneNote secure? It's through Microsoft Suite, so
depends on if it's the paid for version, then it's like you have to, if it requires 2-way authentication, which most of the time it does, then yes, it is. I got a text back.
About the
only if so. The question was, see this, I feel bad because this was a really easy thing to do and I didn't do it for a week. Will referral partners be TPMO? Because we talked about like if the future rules don't go through, then like TPOs can't sell to other TPMOs, can't sell leads, meaning that you couldn't buy leads anymore. Will referral partners be TPMOs, and will they need to be reported to the carriers? My compliance officer, Shaylin, says only if they're being compensated. So if you are paying a referral fee, then yes, that would be considered TPMO. Then that would need to be reported.
Makes sense.
The best. Thanks.
So find some that see the value in you and you're not paying them.
Yeah,
you don't have to report them.
You don't pay. Oh, that's a text message from my husband. It said, hello, wifey. I'm like, who are you? That was my husband. So yeah, be like Kari and don't pay for leads. Because you're better than that.
We offer a very valuable service, guys. So many.
Which includes talking about cancer.
Yes. And I'm going to do that more.
I appreciate you allowing me to bully you.
It's what I needed.
I'm very aggressive today, and I'm sorry for Kari. I'm not sorry for anybody else. This is what everybody else signs up for.
We've had a long episode today. 10:45.
And we started a little bit early. Thank you guys so much for hanging out with us. If you have any questions, comments, concerns, thoughts, or promises, give me a call or shoot this number a text. This is my cell phone. Shoot me a text. I'm happy to answer any and all of your follow-up questions. Appreciate you all so much. So until next time, have fun,
make money,
and give impeccable service. Thanks, guys.